right. Well, good evening, everyone. My name is Jeanette Angulo, and I'm the Imperial County Public Health Director. And the purpose of tonight's gathering is to share information about, the local emergency medical services agency that's under the Public Health Department, and also talk a little bit about Base Station and our role and, the situation and next steps. I won't be talking about that. I'm more of a facilitator tonight, but I do want to introduce several of the individuals that are here that will be speaking. And it's County Chairman Ryan Kelly. He'll share some information with the group. And then I'll pass it on to Dr. Monday, our Imperial County Health Officer. After that, Dr. Catherine Statz, our Medical Director for our local emergency medical services agency. And then finally, I'll hand it over to David Craiglow, who is our EMS manager. So with that, Chairman Kelly.
Thank you, Jeanette. So I knew about this meeting, and I did not intend to join in, but after talking with Jeanette yesterday, I thought it was important to maybe answer or to put a bit of rationale behind why we're going to be getting together on Saturday. So if you're not aware, on Saturday we will be having a future of healthcare in Imperial County, roundtable discussion, and just to share a kind of a framework and objectives that we want to focus on the future and not on past grievances. We do not want to bring about anything that may have occurred in the recent or near history. We want to focus on how can we address the needs today and what we're going to. I know that there are some plans that have already been shared internally and externally, and I'm hoping that we can discuss those, the merits of those, and maybe hopefully find a consensus to be able to shore up both facilities and to maybe find a common ground to bring into a county-wide health district, hopefully. So I just wanted to speak to that, let you know what the intent was. I may be too optimistic about the outcome, but I'm hopeful, and I'll remain hopeful until hope is dead, and I don't think that day will come. So I'm free to answer any questions, but I don't want to take away from the intent of this meeting, because I know that Jeanette and David have some information that they definitely want to share.
All right. Well,
I'll just jump in and say I'm really excited to hear that you're doing that and bringing that together and trying to broaden out that base. I know with some of the people I've talked with, that seems to be the most likely solution if that can happen, which I know is going to be hard to do, but it's refreshing to see the county taking leadership on this.
Right. Well, I don't know. I think we might have somebody checking egos at the door, but we'll see if that works. Perfect. I appreciate the support.
Thank
you. All right.
Thank you, Chairman Kelly.
Thank you, Jeanette, for the invite, and all of you have a good night.
Good night. Good night to you. All right. And with that, Dr. Monday. Dr. Monday, our health officer.
Hey, everybody. It's Steve Monday, Imperial County Public Health Officer. I don't want to take away from our content experts who are going to be speaking next, because really this meeting is about sharing information, and we really want to make sure that we get correct and as much as possible thorough information out to everyone. So that's why we have David and Kathy on tonight, because it's really important that people understand how the EMS agency and Imperial County works, what the components are, and how they interact with each other. What role the health department plays in that, and of course, the role that all of the medical providers and the patients and the hospitals play in that as well. So really, this is our opportunity to share information, because a lot of information's been flying around and not all of it has necessarily been accurate. So we wanted to take the opportunity to get the content experts on with you guys to share information and answer your questions as appropriate. So I'm going to turn it back over to Jeanette so she can really introduce the stars of our show tonight, who are really going to be the ones to give you that information. Thanks, Jeanette.
Thank you, Dr. Monday. And before I hand it over to Dr. Stats, I just want to share that throughout California, and there are local emergency services agencies, and not all are housed within the public health department. In Imperial County, it is housed under the public health department. There's a section, and we have a medical director, and that is Dr. Stats, and then again, the EMS managers. So just wanted to share that before I handed it over to Dr. Stats. Dr. Stats?
Wonderful. Thank you so much. So I did also want to introduce myself, Dr. Kathy Stats. For this phone call or meeting, I'm the EMS medical director, but a little bit of background as well about my work in the county previously. I am currently a physician at El Centro Regional Medical Center as well. And then I've previously served as the base hospital medical director as well. So 4 years now, I've been involved in the process of base hospital medical oversight, and now with David served to provide that oversight over the entire county for EMS services. It is a pleasure to meet everyone today. I think Paul and Dr. Sadeh are the only faces that I haven't met personally before, so it's a pleasure to see you. And you know, what David and I are going to talk about today is where we're currently at, because there's been, honestly, sometimes it's hour by hour, a change in the situation. Our role as the LEMSA, or the local EMS agency, is to help provide oversight to our county, specifically for our paramedics and our EMTs. As required by state statute, we need a base hospital to continue that oversight for paramedics. Without a base hospital, we are able to continue to have EMS. So that means 911 services are able to continue. However, we do not have the ability to have paramedics. Due to the immense financial straits that have occurred in our county, as we're all aware, from COVID, ECRMC shared with us that they would be unable to continue their service as the base hospital site. I will hand it over to David in a moment about what we've learned since then and sort of updates on that process. But based on that, and as the LEMSA, we recognized this was an acute emergency in our system, and we needed to take any steps possible to be able to continue those paramedic services. The current end date of that resignation letter was March 22nd, or is March 22nd, 2023. And so we did put different sort of feelers out to multiple different opportunities, reaching as far as to the state, but of course, beginning locally with our other hospital and county pioneers. Currently, they have expressed interest, and El Centro Regional has also expressed interest in continuing after learning about what the loss of a base station would mean. And so in some ways, we are in a prime position to focus our efforts in an area that would allow the greatest good for the greatest number of people, and hopefully minimize the resources in county. With that, I'll hand it over to David, because he has really been driving the nuts and bolts of this and has been the boots on the ground.
Thank you, Dr. Stats. And don't be modest, Dr. Stats has been very hands-on and on board with this, and she's helping lead us accordingly. And I greatly appreciate her efforts and assistance in all this. So what I'd like to do tonight for everybody is I'd just like to outline basically kind of what started this, and this is all pertaining to the base hospital portion. I know that there's been other things that have happened within the hospital with OB and pediatric, and we've been a part of that from an EMS perspective as well in the field. And I can share at a later time with the group if anybody has any questions regarding that, what we've done. for the community and for the EMS system. But tonight, again, I'd like to focus just on the base hospital portion, and I want to share a timeline. I won't go into full detail. I will kind of reiterate some of the stuff that Dr. Stats shared. But with that, I want to share initially when this all started. So on December 22nd, we received a notice through our public health director from the hospital, CNO, that they would be seeking to terminate their status. All Central Regional Medical Center would terminate their status as a base hospital for the county. On December 26th, they sent over an official notice, and the 90-day notice went to March 22nd. Now, I do want to clarify before I move on, because I know that there was some confusion, and I do want to stress this to the group and to anybody else that might be listening in later on. We never at any point went without base hospital coverage for this county, meaning that none of our response capabilities or our EMS capabilities in the county were or have been affected to this point. We have had full ALS care in the field. We have been able to transfer any patients to the appropriate facility, whether it be Pioneers Memorial Hospital or El Centro Regional Medical Center, and those ERs continue to function to their normal capacity as before. So I'd like to make that clear with this group, that nothing has been affected in the system. But as Dr. Stats did state, the potential of this the potential was that we could potentially lose ALS care coverage in the county. So immediately we as an EMS agency and public health jumped on this to begin talks and look at what possible solutions we could come up with. Obviously, our first solution was to go to our second base hospital, which was Pioneers Memorial Hospital. And we began discussions with them of what it might look like for them to take over as our base hospital. Those discussions have continued, and I will give an update at where we are with Pioneers Memorial Hospital in a little bit. As far as El Centro Regional Medical Center goes, again, I want to reiterate, they did continue to provide the service to the EMS system and to the emergency system as always, as they had before. That has not been affected. Now, I want to give a little bit of understanding and some definition into what this entails and what a base hospital entails. So first, I want to talk about the local EMS agency with the group. An acronym for that is LEMSA, Local EMS Agency, and we as Imperial County EMS Agency are the local EMS agency. So what is the local EMS agency? In the state of California, every county is granted the authority to establish a local emergency medical agency, or LEMSA, to oversee emergency operations within the county. The LEMSA has oversight of all the certifications, policies and procedures, protocols for field personnel, quality assurance, and keep all providers and stakeholders in compliance with state statute. Under the guidance of our medical director, Dr. Catherine Stats, the LEMSA ensures that all of our EMTs, our advanced EMTs and paramedics operate within a set scope of practice outlined by the state of California and follow established treatment and protocols. This includes all fire departments, transporting agencies, and some of our local law enforcement agencies as well. As part of maintaining compliance with the state and to provide advanced life support care in the field, we are required as the EMS agency to assign a base hospital into the county. And for over 30 years, El Centro Regional Medical Center has been that base hospital. So just a little insight onto what a base hospital actually is and what their function is for the EMS community. The base hospital is a 24/7, 365 source of direct medical control, which is utilized by EMS personnel to provide treatment in the field. The base hospital is responsible for directing advanced life support care within the EMS system in Imperial County. The base hospital supervises pre-hospital treatment, triage, and transport of advanced life support patients, as well as monitors compliance by direct medical supervision. The base hospital also provides oversight of EMS policies and protocols being utilized in the county, and the base hospital offers a much needed and required resource for our field personnel. So a little example of how this is utilized by our field personnel. If I, as a paramedic, am in the field and I have given all my standing order doses of a particular medication, then I would reach out to our local base hospital, either a local, either the doctor or a certified nurse, and a mobile intensive care nurse, or what we call an MICN, and I would request online medical control to assist or request that further dose. If I had a complex case, such as a pediatric patient or a cardiac case that was getting beyond my scope, Again, I could reach out to the hospital for medical control. I want to reiterate that we have had that 24/7, and that has not gone away in Imperial County. If the LEMS is not able to establish a base hospital in the county, as Dr. Stats said, we would potentially lose we would lose the capability to offer that advanced life support service in the field, the paramedic field. But again, we have that established. Now, I want to move on. As far as our discussions go with both El Centro and Pioneers, beyond that, we also looked out for other contingencies. We've been in contact with surrounding counties and surrounding base hospitals to assist, but I do not want that to be confused with this group or anybody else that may get a hold of this information. Never were these patients to be sent out of county. And I know that there was some confusion in that area. The only role that any out-of-county resource would play to Imperial County was to provide base hospital oversight for the county. And again, that would just be that online medical direction, that QA, QI component that they would provide to the county. But nothing here in county would have been affected. We would have continued to transport to our local hospitals, just as we have done for the last several decades. In moving forward with all these conversations, again, we had to look into all of our options for potential contingency plans. I want to make sure I get these dates correct, so excuse me for just a second as I look down here. On January 23rd, El Centro Regional Medical Center did announce publicly that they were going to rescind their letter. On the 23rd, on the 24th, they also shared that with our Board of Supervisors that they would be rescinding that. Now, we have made a request from El Centro Regional Medical Center for that in writing, and also what that entails and where we are to move forward. We've already begun discussions with them to see where we will remain, or whether they will remain as a base hospital. And I don't want it to be lost to this group either. Their desire is to remain as a base hospital. They are just seeking a way to assist them in maintaining that status. Now, as part of our talks, we did reach out to Pioneers Memorial Hospital, and we began discussions with them. On the 23rd, the board of directors from Pioneers Memorial Hospital voted unanimously that they would take on the role of base hospital. And we have begun preparations to move them into that position. And that's a very detailed preparation. We won't get into the nitty-gritty of that, but those conversations are being had. And we're continuing with that as part of our plan for coverage for the system. Now, El Centro Regional Medical Center is still in the conversation. We still desire to continue those conversations with them. And again, I'm going to reiterate again, the EMS and the response capabilities in the county have not changed. From 911 response in the field to the capabilities of our ER departments and their capability to receive patients, that has not changed. And the discussion right now is to make sure that that doesn't change at any point. I know a lot of people were concerned about that deadline, as I was, the deadline given on March 22nd. And now we are in a discussion phase with the hospital to see where we're at with that. And with that, I can turn it over to the group. Dr. Stats, if you had anything you'd like to add to that, or any clarification you would like to add, or if we had any questions.
That was an excellent summary. The only addition I would say is part of our goal in meeting today is so that you can put a face to the local EMS agency. So when you have a question, you know that myself and David are going to be the points of contact. And so you can feel free to call, text, email, if there's a question about what's going on in county. It is always our first priority to prioritize our patients and ensure that there is no loss or even pause in care for them. And so that continues to be our goal. And I am confident with all the interested parties that we will find a solution as we move forward. So I'll hand it over.
Appreciate that, Dr. Stats.
Go ahead, Paul, you have a
Oh, I
comment?
was just saying, I appreciate that. And this is, again, new in my relationships with Imperial County. This is very, very helpful to put faces to everybody's names. I took them all down. If I can get contact info from Jeanette at some point after this, that way when Dr. Zade and others are calling me for stuff, I will be able to get in touch right away.
Absolutely, and feel free to include in the CC Dr. Monday, me, even Rocio Ramirez, because she's also part of the team, and in public health, that's how we function as part of a team.
I did talk to Dr. Monday a few weeks ago, and I've gotten his cell
Excellent.
already related to this. And I guess he's a Sharper-Steele physician, I found out too.
Yep, that's right. Dr. Sadeh, you have comments, questions?
No, thank you, Dr. Stats. David, very informative. It was actually some of my questions were answered and when David explained everything, and that was very informative. Thank you so much for your help and for caring for the local.
Thank you. And thank you for being here tonight. We really appreciate it.
I
Yeah,
appreciate it. Thank you.
I did want to say one thing, if I can.
absolutely.
Yeah, this is James Nelson. That's awesome, first of all, that both hospitals want it. There was a point where you all were very nervous that neither hospital wanted it. So that part's good. I just want to say that, you know, I've been a physician at Pioneers for 17 years, and I was trained in base hospital medicine at UCSD, but I've never been like EMS fellowship or whatever. Want to acknowledge that UCSD has done an awesome job. Kathy came from UCSD, of course, and then, you know, Aaron. And so the doctors on El Centro, there's no doubt that the doctors are awesome and well-trained. I do have a new hire starting in July who, if we became the base hospital, he would be interested in leadership. He's very engaged, very well regarded in his residency. I think it's only the hospital side that has any doubt. I mean, you know, like no one has any doubts about the El Centro ER doctors. And I don't mean to raise that as like getting into it, but I do want you guys to know that if for hospital reasons, Pioneers has to do it, the physicians will invest the time to do a good job on that. So I just want to offer that reassurance, but I'm not trying to push for it. That's really hospital to hospital.
Thank you for that, Dr.
Thank
Nelson.
you, Dr. Nelson.
Absolutely. There needs to be a lot of conversation and coordination between both hospitals and our local emergency medical services agency, the public health department. So thank you for that. Other questions, comments?
I wanted to share on that note as well that there's been incredible support from the base hospital leaders at ECRMC for any transition that would occur. So both the lead MICN and the base hospital physician have been very willing, if there is to be a transition, to help aid in that transition. And I think it's evident as we know that the community really comes together in Imperial County. And so I think that will help as well as we move forward.
Absolutely. So make a call, one last call for questions or comments. If none, I reached out via email to all of you. You have at least my contact information. If any other question comes up after this meeting, feel free to reach out, and then I will send it over to Dr. Stats and to David. And yes, we'll keep the group informed, and we'll share information with you, Paul, so that you can share with Medical Society. We've recorded. Hopefully I'm successful in retrieving and then sending it to you. If it's not tonight, it'll be tomorrow. So
Yeah, tomorrow's totally fine.
And just one more last thing for the group and anybody that might see this, please feel free to reach out to me anytime for any clarification that might be needed. I am available 24/7. I can meet in office, I can meet over the phone, I can meet via Zoom. We want to make sure that all of our providers in the field, any questions or concerns that they have, that they're receiving the appropriate information. So please don't hesitate to reach out.
yes, thank you.
And same with me. If there's stuff to get out to the physician community, send it my way, and we'll make sure to get it distributed to everybody.
Absolutely. And then just before we end, there was one date that was provided. I just want to make sure everybody has that date. Formal written notification, December 27th. I
Yes.
believe we missed it by a day, but just want to make sure since we were sharing the exact dates. All right, everyone. Well, thank you all for taking the time to talk to us. And if there's nothing else, have a great evening, everyone. All right.
Thank you
Thanks,
so much.
everybody.
Yeah,
Have a good night. Thank you.
Bye.